Imagine turning 65, and instead of relaxing and enjoying your twilight years, you realize that the Medicare plan that you selected does not cover some of your prescription drugs, your doctors are not in network, or you missed a critical enrollment period. These are the things that happen every day to well-meaning senior citizens, and they are left in a turmoil and left in problems and not sufficient health coverage. Well, that is not going to happen to you after today. Because in today's content, we are going to be going over the different parts of Medicare, when your enrollment period is, and how you can get enrolled in the correct plan. Also, if you need additional information, we have assisted thousands of seniors in getting the right health coverage suited to their needs. So stay tuned. Welcome back to the Next Level Life Hacks, where we take the next steps needed to go towards our financial freedom and success. Now, turning 65 is a milestone in your life, a great accomplishment, so congratulations if that is you. However, you always need someone, an expert, to guide you through the steps that are next in your life so that you do not make the wrong decision. Now, today's content is going to serve as a critical tool that you're going to be using so that you can navigate the world of Medicare and therefore enrolling in the correct plan. And as I mentioned before, our agency has several agents that if you are in doubt or you're not sure how to navigate the space, then put it in the comment section or contact us below so that we can guide you through the process. Now, the first thing that we're going to be looking at is to know your ABCs, as the argument is. Now, your Part A covers hospitalization, and this includes inpatient stays as well as skilled nursing. Now, your Part B, as in boy, that's what covers your medical portion, as in seeing providers and outpatient care. Now, Part C, as in cat, that is offered by private insurance companies, and they usually have lumped together A, B, and D as well, which we're going to be looking at later. Now, the Part D, D as in Delta, is standalone plans that cover only prescription drugs. And as I mentioned before, you can get a Part C that includes Part A, which is hospitalization, Part B, which is medical, and Part D, which is prescription drugs. Now, Part C is where you get all the bells and whistles depending on what you qualify for and depending on your zip code. Now, Part C can cover other things such as dental, vision, transportation, as well as a fitness program, as in Silver Sneakers or Silver and Fit. Now, I must warn you that a lot of persons decide to take Part A and B only, but you must remember that Part A, hospitalization, and the Part B, medical, are restricted in what they cover, and you are left with a 20% co-payment because Parts A and B, they will only cover 80% of the cost of your service. Now, one quick note here is that you usually automatically qualify for Part A based on the number of years that you or your spouse have contributed into Medicare or have worked in general. Part B, however, as at the time of making this video in 2025, you do have a monthly premium of $185, and it usually goes up every year. So for 2026, you more than likely will see an increase in that number. However, this $185 is not a specific and set amount because it is income related, and we'll look at that later on in this video as well. The next question that I am frequently asked, and a lot of seniors misunderstand, is what is your enrollment window? You generally have a 7-month enrollment period that you can get yourself from your enrolled for Medicare. That 7-month period is broken down into the 3 months that are before your birth month itself, and the 3 months after your birth month. That makes up that 7-month window. Now, let's look at an example. If you were born in the month of April, you can enroll for Medicare during the months January, February, and March. Then you also have the month of April that you can get enrolled, and you can also get enrolled during May, June, and July. So your enrollment window is from January to July if you are born in the month of April. Now, you might be asking, so what happened if I missed this window? Because someone watching this video right now might have just missed the 7th month window. Well, unfortunately, for every 12-month period that you do not get enrolled for parts A and B, you are charged a 10% penalty for the rest of your life. So remember though that it is for every 12-month period that you have missed being enrolled. So if you enrolled 3 or 4 months late, you would have to have a SEP, a special election period, that you can get enrolled in the plan, but you would not be charged this 10% until you hit the 12-month mark after the last month of your 7-month enrollment window. Make sense? Put it in the comment section below if you need this to be clarified more, or if you understand what I'm explaining to you. Now remember that I mentioned part D as in David, that you need to get to cover your prescription drugs. Many persons are of the belief, or they make the decision, that they do not currently take any prescription drugs, so they do not need to get enrolled or pay for a prescription drug plan. But oh, you might be wrong, because we are mortal beings and our biological system and our human bodies were not expected to last to perpetuity. Therefore, there must be some degeneration or some decline in our health as we get older. Take for example Marcia. At the time that she enrolled in Medicare Parts A and B, she took no prescription drugs. However, unfortunately, 1 year later, she discovered a chronic illness that resulted in her taking prescription drugs that costed $600 per month. Now, it is not too late for her to get a Part D plan. However, you will then be charged a late penalty fee, which is 1% of the average cost of a prescription drug plan in the industry, and that will be added on to your $185 per month for the rest of your life. Another confusing area for my seniors is Medicare Advantage versus Medicare Supplement plan. And there are strong opinions as to either one of them in terms of what persons might choose to select. We are not here to force you as to which one you should select. I'm just going to be giving you the information. And if you need more in-depth information or to get enrolled in a suitable plan, then simply contact us. Now, Medicare Advantage plans, otherwise known as Part C plans, those are the ones that cover the additional ancillary benefits like dental, vision, transportation, over-the-counter items, allowance, etc. Now, these mostly come with a $0 monthly premium. There are a few that have a monthly premium and they will give you additional benefits, but I would say 90% of Medicare Advantage plans, they do not have a monthly premium. However, there are restrictions for these plans. One, whether they come in an HMO or a PPO plan, and I can dive deeper into that in the next video, you have to stick within the network that is provided. So you have to make sure that your doctors, and do not forget your pain management specialist, your cardiologist, any doctor that falls into the specialist category, you need to make sure that they are also in network for these plans. A lot of seniors only focus, and a lot of negligent agents, they will only look for the PCP to make sure the PCP is in network. Then they do not do a deeper dive to make sure that all the specialists are in network as well. And then when the client goes to see their psychiatrist, their cardiologist, their nephrologist, they are realizing that they are not in network for the plan that they have selected. So due diligence is critical at the beginning of the process. For Medicare supplement plans, however, there is no network as long as the doctor accepts Medicare, located anywhere in the United States, then the Medicare supplement plan can be used. Now, the Medicare supplement plan, however, has a trade-off in that it does not include prescription drug coverage or dental or vision. However, these plans normally run anywhere from $100 to $400 per month as a monthly premium. Another thing that I forgot to mention with the Part C Medicare Advantage plans is that they also include worldwide emergency and urgent care coverage. So again, your needs and your lifestyle needs to be assessed properly by the agent. So if you are someone that travels outside of the country frequently, then it is good to have a Medicare Advantage plan that includes that worldwide emergency and urgent care coverage, so you have some protection whilst you're overseas. But as I mentioned to you before, put in the comment section below if you want me to delve deeper into this topic as well. The other question frequently asked by seniors is, what if I am still working? Do I need to get Medicare? My advice is that you still get the Medicare Part A because there's no monthly premium for that and you automatically qualify for it. But the Part B that includes medical, like your provider's office visits and your outpatient care, if you have employer coverage that is credible, and when we say credible, it must be at least the minimum standard of a Medicare plan, then you can continue keeping your employer coverage and you can hold off on getting the Part B for that additional monthly premium because you have other credible medical coverage. My advice here, however, is to make sure that you check with Medicare that your employer coverage is credible in their eyes. Also, make sure you keep good documentation of that approval from Medicare or that correspondence or communication that states that your employer coverage is sufficient. Once you leave your employer coverage, you usually, as at the time of this video, have an 8-month window that creates a special enrollment period that you can then get yourself enrolled for Part B and then to get a Medicare Advantage or a Medicare Supplement plan. Make sense? Let me know in the comment section below. Remember I said to you earlier that it is $185 per month, depending on your level of income, that you pay for the Medicare Part B. However, there are other thresholds that will have you paying higher amounts if your income was higher while you were working. And I'm going to read them for you so that I get the numbers accurately. So if you were earning equal to or less than $106,000 per year, you would pay the $185 monthly premium for Part B. Remember, we're talking about Part B because there's no monthly premium for Part A. Then if you earn above $106,000 up to $133,000 per year, then you would be paying $259 per month as the premium. If you're earning over $133,000, but say less than or equal to $167,000, then your monthly premium would be $370. If you're earning more than $167,000, but equal to or less than $200,000, your monthly premium would be approximately $481. And over $200,000, but less than $500,000, it will be $591 per month approximately. And if you were a high income generating individual that earned over $500,000 per month, then you'll be paying the maximum premium amount of $628 per month. How do you get around this? If you qualify for Medicaid, and that's not Medicare, Medicaid, which is state related, then this amount could be covered for you by the state, but you have to make sure that you keep on recertifying for Medicaid each year so that you can get the benefit of having your Part B premium covered. Or if it is that you qualify for low income subsidy or extra help from the state, then you could get assistance with this monthly premium, that $185. Now, just to remind you that the Medicare Part A and B, as I mentioned earlier, they do not cover everything. Remember that they do not cover long-term care like nursing homes. They also don't cover the dental, the vision, and it does not cover prescription drugs, as well as it does not cover any worldwide emergency care if you're traveling outside of the country. So remember that there are different aspects. It can be very complicated if you don't know the basics, but if you follow the steps that I have mentioned or the guidance that I have mentioned earlier in this content, you're well on your way to navigating the world of Medicare. I will be going forward as well be releasing one content per week that has some component of Medicare coverage included so that I can make the landscape more understandable for you. Remember again, if you need any assistance or if you're an agent that is looking for a home to be a part of, join us here at Future Solutions LLC, where we will give you the guidance support that you need, as well as if you're a client, we can navigate the space for you and give you the best recommendations that suit your needs. Thank you for watching. Thank you for the privilege of your time. Watch the advertisement next if you are an agent looking for a home. Thank you for watching and see you in the next video.
Are you a licensed life and health insurance agent in Florida or Georgia? Then listen up. At Future Solutions LLC, we're not just offering a job, we're building a mission-driven team that helps people navigate life and health insurance with a strong focus on Medicare solutions and a full range of services to meet every need. Right now, we're growing fast, and we're looking for motivated agents to join our expanding team. Here's what you get when you work with us. Qualified leads, so you're not wasting time chasing cold contacts. Top-tier training and mentorship, whether you're new or experienced. High commissions and bonuses that reward real performance. Flexibility to work your way, remotely or in the field. And best of all, a team that actually supports you. So if you're ready to grow your book of business, serve more clients, and finally be part of something bigger, this is your moment. Send us a message with the word agent to learn more, or apply now and start building your future with Future Solutions LLC.